You never imagined that facial paralysis was not just an aesthetic problem. When you try to speak, air escapes from your mouth. When you eat, in the middle of a table full of people, the food ends up dripping from your lip. This is extremely frustrating and debilitating. You go to the doctor and he tells you it will get better on its own. You go to another doctor and he says there's nothing to be done. So, this video is for you who are going through facial paralysis and don't know the correct treatment. Well then, we have two types of patients for facial paralysis. And then you will identify whether you are one or the other. We have that patient who goes to sleep with a slight earache and then the next day finds it a bit harder to speak. When he tries to drink a glass of water, the water runs down his face. Are you this patient? If so, comment below when your paralysis started. And how did you discover that your face was paralyzed? This type of injury is Bell's palsy, or Hansen-Hunt syndrome, which is a paralysis that occurs spontaneously because your immunity dropped a bit and then the virus attacked the facial nerve. Normally, patients who have Bell's palsy or Hansen-Hunt, which is the spontaneous paralysis we're talking about, will end up having a nerve injury that improves after a few weeks. Most of the time, okay? Some patients have a more severe injury and end up not improving. Right, so this is the first type of patient. The other patient, which might be your case if you're watching, is the one who is going to have surgery. And after the procedure, discovers that their face is not moving in the most appropriate way. For example, a surgery on the parotid gland, a surgery inside the head, or even a cosmetic surgery. I've had several patients who have facial nerve injury after plastic surgery. If you are one of these two types of patients, first and foremost, you will always become demotivated and make mistakes in your treatment if you compare yourself. I know it's hard not to search on Google, right? Facial paralysis, will I get better or not? That's probably why you ended up on this video. However, I'm going to give you a tip. Every time you compare yourself to someone else, either you feel very at ease because you see a very severe case and think, oh, I don't need to do anything because I'm much better than that patient. Or you become desperate because you see someone in the comments below this video, for example, saying, I had facial paralysis, but my condition improved a week later. Well then, in Bell's palsy, which is the one caused by the virus we talked about, most of the time there's not even enough time to have a sequel. It improves very quickly. So, first of all, do not compare yourself. Regardless of the type of paralysis, whether it's Bell's palsy, or after surgery, or after an accident, you need to undergo the most appropriate treatment to achieve your best result. And that's what we're going to talk about in this video. The correct treatment, regardless of your condition. Folks, if you experience this spontaneous paralysis from one day to the next, without any accident, the initial treatment is to seek a specialist doctor. Understand if it really is Bell's palsy, and that you are not experiencing something more serious. Alright, I saw the specialist, went to the emergency room, had tests done, and I found out it is indeed viral paralysis. What is the treatment? The initial treatment is corticosteroids, we use prednisone, and the antiviral, which is a medication given for the virus helping you recover faster. The corticosteroid is used to prevent the nerve from swelling, and the medication for the virus helps you heal from the virus that was attacking your nerve. With the use of these medications, you can start physiotherapy. First, use the medications if you have one of these conditions. Usually, after a few weeks, you will start to improve. If you are a patient who had an injury after surgery or after a procedure or some accident, it is similar to a patient who has spontaneous paralysis, but more severe. Why? Because it will take many weeks, sometimes even a few months, and sometimes you will not fully recover. And that's what we are going to talk about from now on. Has the condition of the patient who used corticosteroids, took medication, and did lighter physiotherapy already improved? Bell, that's great. Now, for the patient who will take longer and needs to do more targeted physiotherapy and might need surgery, follow this video until the end, because it is extremely important for you to achieve your best result and not have unnecessary sequelae. Bell. So, first of all, seek a specialist. The doctor who attended you in the emergency room, or a clinical neurologist who deals with other conditions that are not facial paralysis, helps you at the beginning. However, now he doesn't have more information. Are you going to ask about synkinesis, about stiffness, which are issues we discuss in the videos here on the channel? He won't understand and won't know how to help you. So, who is the doctor that understands a lot about facial paralysis and will attend to you from now on? There are two the plastic surgeon specializing in microsurgery who has extensive knowledge about facial paralysis, and the neurosurgeon specializing in peripheral nerves. These two professionals work extensively in the field and have treated many patients with more severe facial paralysis. So, they have a wealth of information to help you. From now on, I had the consultation and he conducted some tests. So, the tests show that there is reinnervation, for example, that electroneurography test. So we understand that you might improve. From 1 month's follow-up to the next, did you see a response? Did your face improve significantly? Great, then maybe surgery isn't needed for now. Let's wait a little longer. Oh no, the electroneurography, that little shock test, said that my nerve hasn't reinnervated at all, hasn't improved at all, and my face is completely paralyzed. So pay close attention, you might need a procedure. Folks, if you need surgery for reinnervation, the doctor who performs it is the one we talked about, who is a specialist in peripheral nerves or in plastic surgery. And then, if you had the surgery, or even if you didn't need it, but your condition is still severe, what physiotherapy should I do? Understand this. When we talk about physiotherapy for facial paralysis, if you don't have someone who understands, that is, a physiotherapist who explains to you what you should do and what you shouldn't, it's better not to do physio at all, because doing the wrong things can greatly worsen your outcome and leave you with sequelae at the end of the treatment. Electric shocks to the face are very wrong, ice on the face is very wrong. Making faces is also extremely wrong and should not be done. There are videos here on the channel that talk only about this, so take a look later. So, the correct rehabilitation is extremely important. Alright, so I had the surgery or didn't need to have it, did the right physio, and then I had a significant improvement, but it still hasn't completely improved. Is there anything I can do? That's what we're going to talk about, folks. The treatment of sequelae from now on. Is it sad to talk about this? It is sad. They are sequelae. Are sequelae things that last for the rest of your life? Not always, because we have treatment for sequelae. For example, Botox. Botulinum toxin, contrary to what some people think, that it makes things stiff. In reality, what does it do? It relaxes the muscle. So, if you've significantly improved the movement of your mouth but your mouth still pulls too much when you smile, to one side, Botox, on that stronger side, helps bring the mouth to the center. In other words, it provides more symmetry. It even helps with physical therapy. You control the dyskinesias and reduce stiffness. And finally, if you experience improvement with Botox, but this improvement is partial or your condition is very severe, especially regarding dyskinesias, which are those movements where you smile and the eye closes, or you close the eye and the mouth moves, or if the face becomes very stiff to the point where you can't smile because the mouth pulls, we have reconstructive surgery. These are surgeries where we make incisions. A small piece of the nerve, a small piece of the muscle is cut to bring more symmetry and make the face more symmetrical at rest. Or when you are speaking, these cases occur when you have a more severe sequela, and light physiotherapy does not improve it. Or you have already done physiotherapy and did not achieve the desired result. Folks, the patient with facial paralysis goes back and forth and ends up discovering fragmented information over several years. In this video, I shared with you information that I gathered over a long time treating various patients, and I will post more information over several videos in the coming months. Therefore, if you liked what was discussed here and you want to know more information about facial paralysis, like this video and follow our channel.